Few things to report on. I don't know here about order of stuff. I'll just plow in here, guys, and just say on the Vaccine Implementation Task Force, just to give you an update on that first. Progress, of course, is underway. An incredible amount of work's been going on. And we've had regular meetings, ongoing discussion right through the Christmas period. We're now projecting that we'll have over 40,000 vaccines in January alone. And those will principally be going into the arms of our frontline healthcare workers. So that's by the end of January, Pfizer vaccines, approximately 10,000 a week. Of course, the convention center facility, the super site, which we're going to be actually touring on January 1st, is going to be the cornerstone of the early applications. Vaccines at that site will start being distributed on January the 4th. We expect that run rate to be about 10,000 a week, but probably a little lower in the first week as you work through the kinks and make sure that we've got the system working. And then we'll ramp it up as we, my 4-H motto, as we learn to do by doing, and get ourselves in a better position to get those vaccines out. We're also very excited to receive the additional Moderna vaccines. More of those be going around the province with our fast immunization teams, getting more vaccines to rural and northern Manitoba as well. In the new year, Dr. Atwell's going to be giving additional information this afternoon, more specifics probably tomorrow. And we'll continue to share report updates with you as we move ahead from the Vaccine Implementation Task Force. Tremendous amount of work's been done, as you know. A lot of this work began much earlier in the year, and now it's paying dividends as we move forward. Preparatory work, and I thank everybody that's involved. There are literally hundreds of people involved in the overall decision-making processes and implementation processes. I emphasize again, though, that as we move into the new year, these vaccines are only going to be hitting a small percentage of the population. So we have to remain diligent. We have to be very careful as we move forward. I encourage all Manitobans, remember that we've got, I'll say it again, 90 days of duty ahead of us here. We've got a vaccine that's not here yet, that's going to be here in increasing availability as we move ahead. But as Dr. Roussen's recommended regularly, and I've repeated, you have to keep following the rules. Follow those safety rules that for many are absolutely essential to their survival. For many younger people, we know that generally there's not as significant an impact with an infection. Nonetheless, we need everybody on the team. We need everybody to be caring for each other now. So that's critical as we move forward. A couple other things on the dosage holdback issues. We've been careful in the early days of, because of course the federal government is solely responsible and has, frankly, for quite a while now blocked our ability to get additional vaccines. So they're responsible for making them available to us. That being said, we've been very careful to guard against having people immunized and then not be able to follow up with the second dose, as is required by the early available vaccines. However, as we move forward, some other provinces have already made the decision not to reserve that second dose, in other words, to immunize with everything they have as fast as they can. We're going to do that, not totally, but largely. We are going to hold back some percentage going forward just in case, but we are going to rely on the supply chains now in future that have been now more clearly established. In other words, in the early days it was very uncertain. We were projecting, and we were told by the suppliers actually, don't count on getting that second vaccine. You better just apply half of it. So you get where I'm coming from on that. We are going to hold back a safety stock. So we'll have a baseline inventory, so we'll be able to withstand short-term vaccine supply disruptions going forward of a week to 10 days. But we are going to try to get as many vaccines out as safely as we can. So we'll have a safety stock. That would mean Manitobans could fulfill the next week's appointments even if a weekly shipment failed to arrive as planned. So we'll have that buffer going forward. The actual level of safety stock is going to vary from time to time, depending on the flows. right? So what percentage we'll need to hold back will increase, we hope, over time as more vaccines become available. But nonetheless, this approach will allow us to get more vaccine into more Manitobans to safeguard them. And those, frankly, as well, who they work with. Other issues, there's many other issues. I'll just say, you know, some jurisdictions had been following our approach. Others had made more vaccines available immediately on the hope that they would get vaccines. We're shifting to a more confident supply chain model now. I think I'll leave it there. I'll just say we have, as you know, we have the highest of all provinces Indigenous population, and a population that's in high risk. And you know that I've been quite clear about the need to consider that, and the need for the federal government to consider the Indigenous population's needs. We've seen outbreaks in numerous First Nations communities and surrounding areas of First Nations communities. We've lobbied the federal government very strongly now for close to 2 months, and they did agree to supply additional vaccines, and those additional vaccines will be coming to us in the next while. So we'll work in collaboration, close collaboration with our First Nations communities. As you know, with the Pfizer vaccine, it's almost impossible to transport that to northern communities effectively. So we have been already working with Indigenous communities to arrange for principally the frontline personnel that work in those communities to be able to come to Winnipeg to get injected, to get vaccinated. We'll continue to work in collaboration to do that, but we'll also have those Moderna vaccines, which are the more transportable ones, in the coming days. And when those Moderna vaccines come, we're going to be working with our First Nations to make sure that we're getting those out effectively, to prioritize where those doses will be going. I think that's probably just a quick update. I'll say that the progress is underway with our vaccine implementation task force. I'll give you just a quick update. And again, as I've done throughout this, I want to make sure that we do share information with you as much as we can. When it gets into the technical side of who gets the vaccine, I want to be very, very clear. That's not a political decision. That's a decision that's made by medical experts, and we act on their advice. And so I will say, I think it's important to understand, we've had regular meetings, we've had ongoing discussion right through the Christmas period on an ongoing basis. We're now projecting that we'll have over 40,000 vaccines available in January. Where they will go, principally, on the advice of our leadership health teams, is to healthcare frontline workers. And not exclusively, but largely, that's where the people are going to be getting those vaccines. By the end of January, we should have approximately 10,000 Pfizer vaccines every week. Now, the Pfizer is the one that, of course, is not transportable. And so that's going to mean bringing some people in from some of the communities to get that vaccine into the city. We'll be touring the new RBC Convention Center super site on New Year's Day. Vaccines at that site will start on January the 4th. We expect the run rate to be approximately 10,000 per week initially. Probably a little lower in the first week, as I'm an ex-4-H'er, so if you know that organization, you know its motto is learn to do by doing. We're going to be learning to do by doing in the first week. Better to get it right than to go too fast. So in the first week, our run rate might be a little lower. As we get good at what we do there at the site and we're able to do more, we will be increasing the capacity to do more. And we all hope, naturally, that we'll get more vaccines, not fewer, as time goes on. So as we ramp up that task force, the vaccine implementation task force is going to be making decisions beyond, prioritizing the vaccine beyond frontline healthcare workers and getting into age group specific and so on, as you've seen some of that already. First Nations, I mentioned, I think, a bit earlier. We did lobby to have additional vaccines for First Nations. We have got confirmation of close to 10,000 of those being available. That work will continue in the coming days with our First Nations partners, and they have an ongoing role in helping us make the decisions around allocations. And I thank them for that. And I thank our First Nations leadership, as I have before, for their work. Some of the communities have been hit hard. Shamattawa comes to mind, others as well. This is not as a consequence of the failure of anybody in the community to provide good leadership. They've been working very, very hard. Our Indigenous leaderships work very, very hard to do the right things to protect their people. And we're working hard to work with them to protect all Manitobans. I want to use this opportunity, if I can, to just share a bit of a preachy dad that I have become through this process, an admonition. 2020 is used to describe foresight sometimes, but it can also be instructive in hindsight. And as we look back at 2020, we know this. When we follow the fundamentals as Manitobans, then we can be winners against COVID. When we forget, then we can't. Thanksgiving weekend stands out in my memory as a sign of our lack of understanding that. When we look at the numbers through the year, and you look at the graphs comparing other provinces' case numbers, and you've seen them, you know, some of them look a lot more like a Loch Ness Monster than ours. There's no bubble, not a big significant bubble early in the year, but boy, was there a double whack. Our planning through the previous number of months helped us not totally withstand those challenges, but largely withstand a lot of the challenges that came with that graph shooting up like it did. We essentially got a first and second wave almost simultaneously. And our frontline workers rose to the challenge and did a tremendous job. Our testing was put under stress, but we expanded our testing capacity significantly, now to the point where we have enough testing capacity to, you know, get back to another rise that none of us want to see. Our tracking, our tracing activities were ramped up significantly, and now we're really in a much better position to be strong going forward. But I use that Thanksgiving weekend as an example now, because we're on the edge of a new year where we'd all like to celebrate. And we'd like to do it in the old way. We can't. We can't do it in the old way this year. So let us resolve to make 2021 better by learning the lessons of the past and then looking forward. The next 90 days is going to be a challenge for all of us. It's continuing to be a challenge for all of us. But we have to remember that if we want to look forward and celebrate the coming year, we have every right to, if we do the right things. So in the coming year, we're going to have a vaccine. I just spent a bit of time talking about increased availability of the vaccine. But the vaccine's not here yet. Not for most Manitobans. So we have to remember to be diligent. Remember to be disciplined. Remember to do our duty. A lot of us look forward to the gradual loosening of restrictions. But those restrictions will remain in some degree to protect all of us going into the new year. So look forward to it, but remember that all those good things that loosening restrictions mean for families and for small businesses can be undone if we're not disciplined and diligent and if we don't do our duty in the next 90 days. And we can look forward, most of all, to doing what we've been doing, keeping each other safe. The vaccine won't be widely available for a while, but that doesn't mean that it won't arrive. It will. The restrictions will remain for a while. It doesn't mean that they're not going to go away. They're just not going to go away right away. And we won't get our old lives back for a while either. But we'll get them back. And what we are doing in the meantime is we're saving lives. What we're doing right now matters. And when I think back to 5 weeks ago when I got those projections from Dr. Rusin and his team that we were going to be at 1,000 cases a day, we took action prior to that. We maintained some of the most significant restrictions prior to that, but we stepped it up. And as people, we all paid the price for that. We lessened our personal freedoms so we could save lives, and we are. And when you compare the difference in those graphs, where we could have been, where we are now, and you look around the country at other provinces who did not bring restrictions in, or who brought them in more slowly, or who introduced more gradual or lesser restrictions, and you see the difference, know, and I want Manitobans to know this with certainty, you've saved lives. Keep doing that. Save lives. We're saving lives today. We can keep saving lives. Let's embrace the challenge of our generation like every other generation had a challenge. We've got a challenge. 90 days. Do our duty. We'll come out of this. We can get through this together. I'm confident in Manitobans, more confident than ever, and I'm excited about the coming year. We'll welcome 2021 the right way. Do our duty, and we've got lots to be excited about in the year ahead. There's my message. Any questions you guys have, I'm welcome to take them.
Looking for a clarification on the 40,000 doses to the end of January. Is that 40,000 vaccinations completed, or is that 40,000 doses arriving in Manitoba? What is the 40,000?
We believe the 40,000 being a net. So that's with holdbacks considered, Larry. We think there may be closer, maybe even more than 40,000 vaccines, right? 45 maybe, but 40,000 implemented. So in other words, in the arms, yeah.
In the arm, 40,000 additional over above.
And then there'll be some will be later in the month, so clearly they'd have to wait, you know, depends on the vaccine. They might have to wait another 3 weeks or 4 weeks to get their second vaccine.
And then at a rate after January?
We hope it accelerates, right? We're all hoping it accelerates more in the new year and that we get more. But that's a federal government thing, and don't take it as a criticism, but the federal government didn't allow us to order vaccines. The provinces weren't allowed. Subnational governments were excluded from that opportunity, and there are reasons for that. I lament that because I was driven to get us as many vaccines as possible, and that's why I pushed so hard for us to have more First Nations consideration and more vaccines, and we did get close to 10,000 more there. Because we're a more vulnerable population, because we have the highest of all provinces percentage of Indigenous folks, and they are more vulnerable.
So do you think that the 40,000 people vaccinated, are they only going to be healthcare workers at this point? Or?
That gets us, no, not all, because we're already working on the Indigenous communities and partnering with them to get vaccines to those communities, as I mentioned, right? So not 100%, but and who's going to determine this? Well, our vaccine leadership teams, right? So those folks, the immunization task force, the vaccine implementation task force, working with our public health officials like Dr. Roussin, are going to determine who gets the vaccine. I should be clear about that. It's not a political decision. That's a medical decision. My understanding is that'll get us about halfway. That number by the end of January should be half of our frontline healthcare workers, those who face-to-face with the public I'm talking about. So that gets us about halfway. Now, it doesn't mean 100% of the vaccines go to them, because there's some, for example, in some northern communities, there is the need when you're there to do more, to do a broader vaccine strategy there. So it's not going to be that simple. But I understand their prioritization. Beyond that goes largely on age. So you'll see age frequently referenced as it being available to people who work in personal care homes above a certain age, and then it drops down. You've seen this already on some of the expanded access, right?
So the plan for people who live in northern communities or more remote First Nations is to fly some of their frontline workers
initially,
to Winnipeg?
Yeah,
okay.
to use, and you can use the Pfizer then, which then allows you to transport some of the Moderna out to seniors' homes. So you may be able to do some of the vulnerable seniors too, you see, because it's more flexible. Moderna is more flexible, I'm told. You can have, I forget what they're called, the rapid access teams, the vaccine, fast implementation teams are being established, have been established, and they're going to be able to be mobile and go to rural sites or to seniors' homes, because transporting seniors into Winnipeg clearly has its own health risks, right? So there's going to be it's a complex strategy. What I have proposed to my communications folks today, again, is that as early as next week, I'd like to review the org structure with everybody. So you have a chance. This is, I don't know how newsworthy this is, but it's good to know for background, because it's incredible the amount of work that's going on right now. You've got close to 50 different subcommittees, subgroups, cross-jurisdictional, in some cases, within not all, but some with Indigenous participation, where you're actually developing strategies in dozens of different categories right now. This has been going on, I should emphasize, this has been going on for some weeks. It didn't just start now. But it's an incredibly complex effort. Don't expect it to go without hiccups, because this is a first-of-its-kind effort. We're learning from other jurisdictions. We're seeing their challenges, seeing if we can avoid copying their problems, obviously. And moving forward that way it's really important. We want to get the vaccines out, but we want to do it safely, and we want to make sure that where the greatest vulnerabilities are, we're addressing those first.
So in the 40,000, is that all Pfizer, or is there some Moderna in there?
There's a bit of Moderna in there.
Right.
I think we're looking, I could have the numbers around 3,600, I think, we're assured of right now, and we're anticipating more by the end of January. So the Moderna is the one, of course, that you can move more effectively. You don't need that intense refrigeration for it, so it has more potential to be applied in various ways.
So
Go ahead, Larry.
when do you think that you'll be able to inform Manitobans on who gets the vaccine in what order, like in a little more detail than you have so far?
Yeah, it's a good question. I think that I know that I just get the notes here fairly regularly from our vaccine implementation task force. They've got discussion groups on some of those issues right now. Right now, it's fairly straightforward, I would say. You know, it's the frontline healthcare workers and it's our vulnerable seniors and seniors' homes that's where the chief outbreaks are. That's where the high-risk outbreaks have been. But then it's getting into, well, should it be, you know, my mom who has, you know, arthritis and asthma is 74, should she get it ahead of somebody else who's 64? You know, this is where I think the prioritization issues have to be dealt with by the healthcare experts.
Indigenous people are saying, well, the disproportionate amount of our
folks have underlying health conditions.
And are in ICUs and in hospitals.
Yeah.
And so
sure.
Where do they fit? Here?
Well, Indigenous input is valuable, and it's been.
And where do they fit in terms of the priority?
Well, that's where the prioritization exercise that the Vaccine Implementation Task Force is engaged in right now is one of dozens.
We'll hear about this
Absolutely.
fairly soon.
Yeah, I think the transparency is key on this. I've said from the start I wanted more, not less, and I'm sticking to that.
Early in the new year, then.
Yeah, I think that it's a question of detail. I don't think this is not going to be an issue until probably into February, realistically. I wish it was, because it would mean we were getting more vaccine. But I think realistically, the frontline healthcare workers have to get the vaccine, and we know that's the key. So that's not going to be addressed by the end of January, unless we see a lot of additional vaccines coming our way. But at some point in January, I think it's very important that Manitobans know if they're waiting their turn. I'm anxiously waiting my turn. I'll wait my turn, but I'd like to know when my turn is. And I think all Manitobans feel the same way.
Mr. Premier, talk about the numbers the last couple of days have been encouraging, right? We'll see what happens after New Year's and if people follow the restrictions.
Critical time.
Yeah. Current set of restrictions, I don't think that, you know, are set to be reviewed January the 8th. I'm assuming, and you keep talking about 90 days, so January, February, March. Do you see any of these restrictions being eased over that 90-day period?
Yeah, here's the dichotomy of this situation. Yes, I think it's almost certain there'll be some easing of restrictions. But yes, I feel very, very certain as a former coach, teacher, parent, common sense person that we have to be very, very careful that we remain diligent, that we remain disciplined, that we remain motivated by caring and compassion for those who are more vulnerable. And if we keep those qualities, then we have a chance to do what we were doing for, frankly, 8 of the last 10 months, which is to beat COVID back somewhat. And if we can keep COVID down with that discipline, then I'll keep preaching discipline like the stern dad I am. And when we show that discipline, we have every reason to be proud of ourselves. And when we don't, we have every reason to be ashamed of ourselves. And I'll say that again. So I'm pleased to see, well, we'll float, as we always do. We'll put out our ideas for some suggested changes. And I won't speak for Dr. Roos, I'll let him speak for himself, or Dr. Atwell in this case. But I anticipate we'll be using the same approach we've used throughout, which is to say, here are some changes we want you to consider. Use Engage MB. We find that thousands of Manitobans are going on the website and saying, okay, I like this, I'm not sure about that, what do you think about this? And they're coming in with, Manitobans are coming in with really good ideas. We've had tens of thousands of Manitobans actively involved in that process. That is important when it's a public health issue. It's especially important because it impacts all of us. These rules impact all of us. And so it's important the public buy into the rules, that the public says, yes, this makes sense. Okay, I know I'd like to have my family over. It's my mom's 90th birthday next week. I'd love to have my family over, but I know I can't do it. and here's why. And I understand that. When families make those individual decisions, the right decisions, we're all safer. But you need the opportunity for Manitobans to have the chance to buy in. I think this model that we've used, it's not the same model used in every province. We're really engaging Manitobans in a sincere way. And we've made changes. Often, some say too late, some say not enough, some say too much. You know, that's okay. We're involving the citizens of our province in this because this is public health, and it depends on all of us doing the right things. And going forward, that's going to be really critical if we can keep disciplined, as we have. And it's Manitobans that deserve the credit. I try not to blame, because I don't think blame's helpful. But I do think, you know of me, that I've said from the start, when we've done well, that Manitobans were the reason. And I continue to believe that the future is in Manitobans' hands now. And this next 90 days is going to be critical.
Are you aware of any MLAs or political staffers who have left the country during the holidays, Manitoba MLAs or staffers? And what would you say to them if they did?
Well, I'm not aware of any, and so B, I don't answer the hypothetical question I won't have to answer because I have too much respect for the discipline of my colleagues. I can tell you that our MLAs, caucus cabinet members are all aware of the importance of setting a proper example. And so I do not expect to see any international travel occurring as a result of any of our team. I forgot to add something, and I should mention something here that I think might be a bit newsworthy. As you know, out of an abundance of caution, we instituted a practice early, several other provinces did too, of holding back half of the vaccine, right, because it needs the second shot, and we weren't sure of our supply chains. We're more confident about our supply chains now, so we're going to change that practice. We will continue to hold back what we call a safety stock, which would mean enough for an anticipated failure of a supply chain for a week to 10 days. So we'll have a safety stock for those who would need to get vaccinated that additional week, even if we ran short or a supply chain was disrupted through some event. But this will allow us to move forward with implementing vaccine strategies that expand on the available first vaccine, which get us a broader number of vaccinations done earlier. Other provinces have moved this way. We made the decision, our health leadership made the recommendation, we made the decision that that's what we would do. So that actual level of safety stock is going to change. It's a moving target because it depends on the flow rate, right? So it'll change from time to time, and we anticipate and hope that we'd have to hold back a little bit more as we started to get higher flows of vaccine going forward, just to be sure we have that margin. But we think that that's a safe course of action to pursue. We're ready. If the next shipment doesn't arrive, we're still protected. But we'd be, and we're taking the chance that has to be taken, we think, safely taken, that this system will hold itself up as it has for the last few weeks. So.
I guess I wonder what changed from yesterday when Dr. Atwell said that wasn't the approach, and now we are doing some, we have a similar rollout now to Ontario.
I think, to be fair, this is a first-time activity, right? We're doing the best we can with a brand new series of issues, and we've got literally dozens of them. I mean, I got a summary sheet the other day of 23 pages of various issues that are being dealt with by our team and by others around them. So there's a ton of issues. I think the big one here is that we were concerned initially that the supply chain, if it failed us, that we would be failing the people we vaccinated, because we'd be giving twice as many people a vaccine, which would be not necessarily effective if they couldn't get the second shot. Now we're learning, as the science is evolving, that the first shot is very significantly effective, though not obviously as good as if you could get the second. And secondly, that our supply chains are becoming more reliable, and so therefore we're developing more confidence in them. So the combination of those things means good news, because we can get more vaccines to more people more rapidly.
Just going back to the easing of restrictions, so are you saying that there's going to be some kind of public online consultation in advance of making any changes, let's say, that take effect January 9th?
Yeah, we'll continue to use that approach, Larry, of getting information out to people.
We'll get a bit of a heads up before January 9th.
Yeah.
What will happen.
Very likely early next week, I would think, Larry. Normally, we try to make sure there's at least 2 or 3 days there where folks can give their input, give us their suggestions. But I've been pretty consistent here. I'm the bearer of bad news, and I've been willing to tell people that they should be disciplined and stay at home even at Christmas, and especially at New Year's. And I'm going to keep saying that. Use that discipline. It's saving lives. It's really important. Dr. Atwell, I know is going to be available tomorrow to give you more sort of specific information than I've given you. And I think this is the approach we'll generally take. If you get into a hard question, Dr. Rusin will take it. If it's an easier question, I'll take it. That's how we're going to deal with it. But again, remember there's 90 days ahead where we have real responsibilities as people to protect one another, and we need to do that.
I was going to ask, just, it's New Year's, so it's obviously a reflective time for everybody.
Sure.
Just looking back at this past year, are there things you would have liked to do differently, and do you have any resolutions maybe for yourself and for the province going into 2021?
Sure. Well, I've said from the start I'd like to see more information out, not less, and I've really emphasized that now with our vaccination task force, that I think the public has a real appetite to see more information, not less. More causative information so they can understand why their small business is closed, more information on why the rules are the way the rules are, not just these are the rules, but here's why. And I think that the use of the Engage MB website has been really helpful in getting people accustomed to, okay, yeah, I'm interested, and then they'll read the proposal and they'll come in with feedback. I think that's good, but I think we need to do more of that. I do believe that participatory democracy matters, and in particular when it's public health issues, you're asking the public to sacrifice freedoms they treasure and value. And they have to understand why they're making that sacrifice. And this is part of my message today, is what you're doing matters. And it's really making a positive difference, so keep it up.
We'll wrap it there. Okay. Yep. Thank you, Mr. President.
Happy New Year, guys.
Happy New Year.
Happy New
For a
Year.
better New Year.
Oh,
Yes.
You bet.
Happy work.
Happy New
Nope.
Year.
Happy New Year.
Thank
Thanks,
you.
Kelly. Yeah.
Thanks, Kelly.